The month of July has seen a steady rise in the number of COVID-19 cases in the country, especially in Nairobi County. Patients who have to be admitted in hospitals due to COVID-19 and their families are facing a rough time since there are not enough ICU beds. Even worse, there is a shortage of oxygen. Fiona Juma is just one of several Kenyans who reportedly lost her life due to lack of availability of oxygen. Her story came to light after she posted on Facebook asking for help, but she passed on just a few hours later before she received any help. This comes just a few days after Health CS Mutahi Kagwe urged Kenyans to strictly observe the COVID-19 containment measures due to the spiking number of cases. The number of cases in Kitui County has dismally been on the rise compared to the month of June.
In observing an increase in cases in other counties, including Kiambu, Kajiado, Lamu, Makueni, Murang'a, Nairobi, Nyandarua, Taita Taveta, and for the first time also, Tana River County.
In Kitui County, basically, we've started seeing the numbers steadily rising. For example, in our facility, the county referral hospital, we found before mid-July, basically the numbers that we were testing positive were around 3 or 4 patients per day. But from mid-July, we've seen the numbers doubling, actually 50 to 60% increase.
Health experts say the new Delta variant is a major factor attributing to the spike in these cases.
If you check, like, you saw people, the viral load is higher, and the duration from infection to symptoms and signs is shorter. And from the time you are exposed, the time you show that you are unwell and feeling lousy is shorter.
The Ministry of Health has now given a go-ahead for the COVID-19 vaccine to be available for all Kenyans, as this seems to be the best solution for the country to beat the virus. Several vaccines are expected to arrive in the country later on this month.
Discussions with the people treating patients, they are telling us majority of the people being admitted are not vaccinated. And therefore, that is why Kenyans should go for vaccination.
If you're bringing us vaccines and the vaccines have a little under 8 weeks to expiry, we shall not be able to receive them just because of the logistical arrangements that need to take place in deploying the vaccine.
Chebet Birir, KTN News.